Dr. Osterholm, let's start with the doctors and nurses dealing with this latest spike and the news from these major medical groups calling for mandatory vaccinations for all healthcare personnel. How important is this?
Well, we assume that when our healthcare workers are there to take care of us, that they're also not going to harm us with an infectious disease that they may carry. So I think this is the one group that it's imperative that they are vaccinated and that we do whatever we can to get them vaccinated. And obviously, it's best when you use the carrot, but if a stick is necessary to protect the lives of patients, then I think that must be done.
And what do you think about the potential new federal indoor mask mandate that is under consideration?
Well, you know, I think the message we want to get out about masking is the idea of respiratory protection, meaning that you are protecting yourselves from the virus. Remember, this virus is transmitted in an aerosol. If you want to understand what an aerosol is, imagine you're in a room and someone's smoking. Can you smell that smoke? That's what an aerosol is. And so one of the things we have found is that the typical face cloth covering over your face often doesn't do much to actually reduce the amount of that virus you inhale in. And so what we really want to emphasize is that what protects you are the N95 respirators, the KN95 respirators. They call them masks, but in fact that they are respirators. There you get really high levels of protection. So it's not just put on something, but make sure you put on something that makes a difference. And finally, in studies that we've been doing, using national media as a way to look at, in crowds on TV screens, how many people are actually wearing face cloth coverings or masks, but how do they wear them? And we continue to see about a quarter of the United States here that they are putting it under their nose. It's for nothing else more than a chin diaper. That's not going to protect you. So if you do wear it, make sure you wear it so it protects you.
And I want to ask you about boosters. There's a lot of concern among people, especially older people or people who are, challenged in terms of their immunities, in terms of when you're going to need a booster, how soon you're going to need a booster. Does it mean that your 2 shots, if you've had 2 shots, isn't effective any longer? Can you give us some clarity on that?
Well, first of all, the 2 shots that you got basically are lifesavers for so many. So please do not for a moment hesitate to think that you did something that now doesn't mean you have protection. You do have protection. It may not be the full protection. It may mean you have less serious illness, less chance of getting hospitalized, and surely a lot less chance of dying. What is being studied right now is when, if we do need to give a booster shot, when is it? And you're going to be seeing much more information coming out in the near term, meaning within days, about any new recommendations about boosters. But in the meantime, celebrate it. If you've gotten your 2 doses of vaccine, you've done everything you possibly can at this point to protect yourself.
But you do lose even with Pfizer, or Moderna, you're beginning to lose your protection as the months proceed. So that is one of the things that are we going to have to be tested for antibodies to see who actually qualifies for a booster? How is this going to work?
Well, what's happening right now, we're looking at studies, Andrea, that includes ones in Israel, which was where the first data was reported on for the Pfizer vaccine, indicating there may be a need for a booster. So this work is ongoing right now to understand when a booster might be necessary. Also, the Delta variant poses some really very unique challenges. You've been hearing a lot of the discussion about the breakthrough infections, and what does that mean? And I think you're going to hear more information forthcoming from the CDC in the next day or two on this very issue of how to protect yourself against the variant and what does it mean for waning immunity? Do we need to get boosters? And so I think right now the most important thing is just stay tuned and know that this information will be forthcoming and everything will be done that can protect the population will be done.
And 2 quick things, not quick, but one is the breakthrough cases. How concerned are you because of Delta? And the other is something that is reported that Dr. Fauci is considering asking for billions in a warp speed-like program to develop new vaccines now for future variants that could be easily reprogrammed for what we expect down the road in years to come.
Well, the breakthrough cases with the Delta variant are a concern. We do know that we're seeing a number of them. We do know that particularly in the older population, people may be immune compromised, they may be more serious illnesses, but we're also concerned about, will people who have breakthrough cases be able to transmit the virus to others, and what does that mean? And again, you know, this is a very rapidly developing area of science, and I think within days you're going to be hearing much more about what we've learned. Remember, science is all about correction. We correct ourselves all the time as we learn new things, as we are able to bring new information to the table. So that's really very, very important. As far as the program that you've mentioned that Dr. Fauci talked about, we are all obviously very supportive of the fact that this is not our last rodeo. This particular pandemic is going to happen and continue to happen, but in fact that there'll be others in the future. So we need to be better prepared. Imagine if we'd had these vaccines ready to go a year ago last January. And so this is, I think, an outstanding effort on the part of the NIH to get us better prepared for the future.
Dr. Michael Osterholm, you are invaluable. Thank you so much for being with us today.
Thank you.